the quick MCQ questions that follows with the videos, all that data is given to the instructor for him to assess where the student stands in terms of his cognitive capabilities. Because usually what happens is in our traditional setup, it takes either a first exam or final exam for the instructor to understand, okay, this student stands here, this student stands here. But sometimes it's too late. So what we do is right from the first week, with this data, the instructor can know, okay, these are the areas that the student, he or she understands easily. These areas, they're lagging behind. So we call our solution SITA, so Skillcraft Integrated Training and Assistance. So like I said, we have AR, VR, illustrative videos, learner management system, adaptive training using data, and learner chatbot. So what we mean by learner chatbot is this whole thing that when we go to a chat GPT, how accurate is the information that we get? Right, so because when you type something on ChatGPT, it goes and goes to trillions of tokens, comes back with a response. You're not sure if it's right. So what we do is we feed the LLMs with a particular textbook that the organization wants, knows that it's authentic, so that the whole all the answers that come are completely curated. So we know that whatever the response from that particular chatbot is 100% accurate, and it's within those defined textbooks. So our projects in healthcare sector, we are collaborating with Savita Dental College, IIT Hyderabad, we're getting incubated there, and Indian Railways as well. So this is a complete high fidelity, high accurate human body that we've developed over the last 1 year with anatomy specialists and doctors. So the vein, the nerves, everything is accurate to sub-millimeter level accuracy. So you can see here, and one of the main reasons why we spent a year to build this is because in virtual reality or augmented reality, there are 3 aspects to it. One is the 3D model. So the more accurate your 3D model is, the better the product or the content will be. And the second aspect is content creation. That is where the collaboration with subject matter experts and doctors happen. And the third part is integrating it into softwares like LMS system and integrating it with AI and data analytics. So this is just to give you a glimpse of the level of precision that we've gone into. So now that we have this 3D model, one of the solutions that we're proposing is VR in human anatomy training. So according to one of the publications, they say that the present ratio of 1:20, 1 cadaver for 20 students, whereas the ideal ratio is supposed to be 1 cadaver for 8 to 10 students. And this is a problem, a shortage of cadaver across the globe. And we're addressing that problem through virtual reality, giving them the feel of actually doing the dissections and the anatomy in virtual world. So the advantages being practical dissections and you can explore whenever you want, 24/7 availability, and it's highly scalable and reduce costs as well. So one thing I want to make very clear, there's always a debate when it comes to virtual reality is, okay, will it give you the real feel? How much are we learning? So I myself, as a founder of a startup that's into virtual reality, I would say that virtual reality is not here to replace your hands-on job training. What we are very clear is, let's say you have 100 hours of hands-on job training, or let's say in this example, you have to perform certain anatomy on a cadaver. It is going to reduce that duration by almost 50 to 60%. So if you spend 100 hours on hands-on job training, because of virtual reality, you're going to reduce it to either 50 hours or 40 hours. So that's the whole aim. And because VR is only to get you familiar with the whole, the hands-on job training that you eventually going to do. And the second aspect is the haptic feed of it. So right now, there's a lot of technology that's being developed on the haptic side of it, because how are we going to get the feel, right? So there are systems right now that actually give you the feel of cutting your skin, bones, and ligaments, and each and everything. So that the pressure can be monitored. And we're doing that for Savita in the dental side of it. So this is one of the example to give you a human anatomy of the skeletal system. So you can pick in every part of, so all the parts of the bone, all the bones are here, and you can see the bone on the screen behind you and its functions. So with this, you can play around and you can, literally like a puzzle, you can pull out everything, put it back, learn more about it, spend a number of hours till you are completely familiar with it.
What's in the module?
So this is another quick illustrated diagrams to show more immersion and more visual learning. When there's a mandible fracture, the causes for it, the preventive measures. Again, all this content is completely customized. Once you have the model, once you have a specific requirement, like in the morning, Dr. Colonel Karuna ma'am said that, it has to be driven from the doctor's side. So once we have the model, if you tell us this is what we want, we're able to achieve that kind of content for you. Another example of single plan
and is a great long-term option, and other material is generally
different procedures to follow, and the same thing will come into VR as well.
The patient. The doctor makes a cut to open your gum and expose the bone. A mid-crystal incision or cut is employed in most cases.
Just a question, to just kindly speed it up.
Yes. This is just a demo for the dental that we did for complete tooth extraction. So you have two steps.
Pick
One
up
is
the bite block
your audio.
from the
You have
tray.
complete audio-visual cues
Place
while
the
you're
bite
performing
block
the
in the lower and upper
tooth extraction surgery. The second aspect can be when there's no audio-visual cues and you have to do it yourself, and the system evaluates.
Pick up the dental mirror on the left hand. Place it near patient's left cheek. Pick up a gauze to clean the patient's mouth.
This can be done for a number of surgeries as well. Just move forward.
Pick up the.
So there's another project that we did for the Indian Railways, critical injury victim handling. So one of the main reasons why this VR was introduced here was to give them a feel of, because in traditional training, they were just making someone lie down on the floor and doing different procedures. But we wanted to give them a feel of when there's an actual accident, be completely immersed
Just
with all
tell
the
me any
noises,
immediate
screaming, and
reports of
everything.
injuries.
So again, a small demo of how it feels when they're.
The passenger is unconscious. In this situation, we assume it's neck or spine injury. Put a cervical collar around the neck and arrange the spine. Keep monitoring and clear the path for extraction.
To kind of increase the stakes. So another project that we are in R&D phase with IIT Hyderabad right now is called the virtual patient. We're using conversational AI to create a virtual patient for you. So what I mean by that is you have an app and you just play the patient, and literally like a patient, they come to you and they tell all their symptoms to you, and it's up to you as a medical student to practice on, okay, what are the symptoms are they saying and how do you diagnose it? So there's so it's a virtual patient, and I mean, it's an R&D phase, a little patent sensitive, so I won't talk too much about it. And finally, the learner management system looks something like this, where every student is evaluated on every topic, and analytics is given to the instructor for him to understand him better and help him better. So in the whole, there's a huge cost and time saving using these technologies. Adaptiveness, one size fits all approach, doesn't really work, and obviously the safety aspect of it, and scalability. Some of the projects that we're doing. So yeah, I think about sums the whole presentation. And we're three co-founders. Jay Surya, who's here, did his mechanical engineering BITS Pilani, and then thereafter did management in Brown. I did my undergrad and master's in mechanical engineering and robotics from France. And yeah, we have a third co-founder who's in the industry for almost 15 years now in AR/VR.
Thank you very much, Rohan. That was very nice. I think we'll keep the questions for later at the end, and request the next Mr. Gupta, that is Arun Gupta. Yeah.
Okay, so well, I will not take much time. I think we already short, so I'll keep it very brief. So I'm Tarun. I'm working on the space of AI at IIT Delhi. I have a startup there. So we are actually, I heard many things about ChatGPT and AI. So we are actually practically working on AI applications, and three things we are working on, and I will cover them very briefly now because with each topic I've spent hours and hours on it, but I'll keep very brief. So the first application that we are working at Vidyarix is we are looking at non-invasive retinal images. We are actually looking at the changes in the microvasculatures that happen at the retina level. We track the changes in the flow of blood at these microvasculatures or capillaries through a technique which is already being used by a lot of ophthalmologists called OCTA, which is optical coherence tomography angiography, which is nothing but motion contrast depth resolved three-dimensional technique. In that, we track the flow of blood and we track the changes in the vessel density, perfusion density, or foveal avascular zone. So this whole concept about startup and AI, the reason I'm here to talk about that, you have to go on the basics that first you have to figure out what the problem is. So then when I was actually being an engineer myself, I was sitting with ophthalmologist and cardiologist together. And then they actually told me there's a very strong systemic link between the changes that happen in retina with cardiovascular, CVD or CAD. And the changes happen first at the retina. Aankh se dil ka raaz, we were actually talking over a cup of coffee. And then it all started from there. Although I'm going to go very, very brief and superficial here because of the time. And that led for my first product where we started using these retinal images and build a pre-screening tool at a triage level or a PCP level to detect an CAD or CVD non-invasively. So on the left side, you can see an OCTA image and you can see the capillaries. And then we extract, this is a sense of AI, which we have been talking throughout. This is the real AI in play. Why we use AI in this? Because normal naked eye cannot see these changes in capillaries, vessel density, or the foveal avascular changes that are happening. We extract the biomarkers using image processing. We take three kinds of patients. One is normal patients with chronic hypertension, and the patients having CAD. We are partnered with 4 hospitals, and we take retro as well as longitudinal data. And then we extract these data and we quantify it, and then we put it in deep learning ensemble models